Back pain is a very common complaint. 80% of the population will have lower back pain at least once in their lives. Back pain is a common reason for absence from work or visiting the GP. According to the NHS, back pain is the largest cause of work-related absence in the UK. Although back pain may be painful and uncomfortable, it's not usually serious. Even though back pain can affect people of any age, it's significantly more common among adults aged between 35 and 55 years. In this programme, we look at the latest innovations in back care and hear the views of family GP and television personality Dr. Chris Steele, Richard Brown and Tim Hutchful from the British Chiropractic Association, Julia Love, Chair of the National Back Exchange, William Varnham, Back Care Manager at Nottinghamshire Healthcare NHS Trust. And Simon Williams from Hypnea explains why memory foam mattresses can provide relief for back pain.
Back pain is a very common problem indeed. 1 in 3 of us will suffer back pain at least once in our lives. It's a major cause of sickness, and people being absent from work. And a lot of back pain is just bad posture. We spend a lot of our time sitting in the car driving to work, sitting at work, sitting in soft chairs at home at night. And this bad posture, of course, can put undue strain on the joints, the ligaments, the muscles. Being overweight puts further strain on these joints. And of course, incorrect lifting. So many people get back pain after bending down to lift something heavy. When you bend down, if you bend over and bend the spine, you're putting the strain on the small joints of the spine, whereas what you should do is keep your spine straight and put the strain on the large joints of your hips and your knees and bend those to go down to lift something upright.
The National Back Exchange is a multidisciplinary organisation made up of members all over the UK and in fact abroad. And we started in the early 80s when there was a big drive to prevent back pain initially in nursing. It's since developed from there, and we're there to promote and exchange good ideas about preventing back pain and good practice, good training standards in all professions looking after people. The key aims of National Back Exchange is to exchange ideas, information, so that our members can keep their staff safe while they're handling patients, but also ensure that patients are kept safe as well.
If you see a patient care situation, and if you see the person giving the care situation, what you've got is an inextricable link between the two in terms of safety. What we're concerned with is safe handling practice of the patient, their comfort, their well-being, but also that the person doing the caring, if you like, is working in a safe way. So that overarching aim, if you like, is fulfilled by the work of its executive, elected members, and also its wide membership. So what do? We put on workshops, we have regular meetings, we have annual conferences, we disseminate information. We look at research, we invite speakers, we pool all this information together and share it, and that's a key factor of the whole of the way National Back Exchange works. For the healthcare professional, the benefits are very important. It's really critical to keep up to date with practice and modern thinking. One of the criticisms sometimes of the whole manual handling affair is that it's rigid. You do this, you don't do that. Back Exchange have broadened that out and widened out that thinking very much. What the healthcare professional needs to know is, are there any new ideas out there? Have I any ideas that I can share? So the professional can keep up to date with current practice, but also know that what they do is reflected by a body of people who have said, we've looked at this, we've scrutinised it, and we say these are good standards. The general public has to be welcomed into this organisation because they are the people that are receiving the care. Without their views, without their knowledge, without their insight, we really will lose our way. It's very well theorising. A lot of our members are highly skilled and very well educated, but How do you find out about what's happening? It's from the public. It's by being out there and getting information from them and their perspective.
I joined the National Back Exchange because as an emergency medical technician, I was teaching people how to do vehicle extrications, how to do various other moving and handling tasks. I started a training company, but I needed to find other people that were teaching similar subjects, and I needed to make sure that what I was teaching was appropriate. One thing I do with all of my delegates now is I actively encourage them to join the National Back Exchange. This makes sure that they're not on their own, that they do have a place they can go to get answers to questions, answers to difficulties. They'll never be, if they are put into a difficult situation, well then they'll be able to find a way out of that situation. The National Back Exchange publish a journal, a quarterly journal, called Column. This particular publication looks at new innovations, it looks at current research which is taking place. It allows instructors to be able to incorporate the very latest information within their teaching sessions.
There are a number of publications that National Back Exchange has been involved in the past, and now we're actually developing our own too. So there's some free publications that you can access via the website, and there's also some good solid textbooks. So the standards in manual handling, that's our baseline as far as looking at standards in manual handling, and now we're producing a series of books, the first one of which is the manual handling of children. Now, this one has been really important because moving and handling children, assisting children, there isn't much out there, and lots of people have to work with children that have disabilities. So this publication just gives a good, solid, sensible start line to help people understand what's involved. As part of it too, there's a template in it to help you assess the risks and to work with the child, with the family, with the school, with the professionals on how to come up with a good moving and handling plan.
Each year, National Back Exchange have conferences. They're 3-day affairs, and when you get there, your feet do not touch the ground. Sometimes it's a case of discriminating on what you want to see and what you don't want to see. There's a lot to see. Equipment providers are there, and they are again very, very generous with the information they will give you. So it's a good place to see what's out there, what people are using, how that's developing. It's also a great place at conference to meet people you haven't seen for a while, get to know them, network, meet new people. And of course the workshops, there are concurrent workshops. So that's a struggle in a sense when you sign up for the conference. Which workshop can I go on? Because invariably you're going to say, I want to go on all of them. But they're all very good, they're all professionally run. And then we have plenary speakers, speakers invited from national organisations, so there's a lot to see, a lot to do, a lot of people to meet, and overall it's a really great and fulfilling experience.
Obviously you can join National Back Exchange as an individual member, but really you want to be part of a local group. So all around the country there are groups of people that meet together to exchange the ideas. Now those local groups also get involved in projects. For example, Yorkshire Back Exchange produced the hoist guidelines, which have been a fantastic aid to helping people work out when they should use a piece of equipment like a hoist. Any group can submit material, and that will be considered and looked at by the organisation. And in fact, it's vital that those local groups do submit material, because that forms the basis of the next set of publications. The website is our key way of communicating with each other and with the public. So there are public areas, there are membership areas, and you will find a whole range of information available. So if you're a member, there are forums to check and to ask questions. If you're a member of the public, it will give you information about where to go for help, what publications are available, and really how to source some expertise.
Manual handling and the prevention of back pain in nurses and all health professionals has changed considerably over the years, and we've got a lot to do. I urge you to join us so we can work together to make it better for the patients and the staff.
With back pain being so common, there are all sorts of areas of help. And of course, you can try and help yourself. You can buy painkillers, you can buy anti-inflammatories. These could be as tablets, as creams to rub on. And of course, you've got professional help. You may go to an osteopath, acupuncturist, a chiropractor, or you may need to see a professional healthcare individual such as your GP. It's a great strain on the NHS, the low back pain problem, because it is so common. And unfortunately, we can't just wave a magic wand to wipe back pain away. We have to educate patients about posture and weight and exercise, etc. So it's common. Most cases of back pain can be treated very, very simply. Some back cases may need hospital physiotherapy. Severe cases might even need surgery.
Chiropractic is a primary contact healthcare profession which is concerned with the assessment, treatment and diagnosis of mainly musculoskeletal conditions, particularly the spine. Chiropractors are best known for treating spinal conditions, and as part of their treatment they incorporate a wide package of care. Chiropractic has a growing body of evidence to support its use. What we're talking about is not necessarily chiropractic care, but we're talking about the treatment techniques that are used by chiropractors. And there's a growing body of evidence to support the use of manual techniques, particularly spinal manipulation, in the treatment of patients with spinal pain. Most recently, the NICE, the National Institute for Clinical Excellence, produced guidelines on the acute management of persistent lower back pain, which incorporated treatments commonly delivered by chiropractors. These include spinal manipulation, massage and supervised rehabilitation. All members of the British Chiropractic Association are obliged to have undertaken a full-time programme of undergraduate education. This is a minimum of 4 years, but the two UK institutions both graduate students with a master's in chiropractic. The undergraduate course consists of the basic sciences that you would associate with any healthcare profession, such as anatomy and physiology and biochemistry, before they progress into more specialised training which qualifies them to be experts in the treatment of spinal and joint conditions. This will involve learning how to palpate, assess and manipulate patients, as well as the use of other treatment techniques that are involved in the package of care that chiropractors commonly deliver. The British Chiropractic Association is the largest and longest established chiropractic association in the United Kingdom. It's also the largest national association in Europe. Its members are all graduates of an approved either national or international chiropractic institution. And we're very concerned with delivering the highest standards of quality and excellence in chiropractic care.
As a chiropractor, I see mainly people with spinal problems, and I'd say a good 80% of those people have got either neck or back problems. Research at the moment shows that about half the population is suffering from back or neck pain. And out of those numbers, 20% of them have actually got chronic pain, and they've been suffering for about 10 years. Chiropractic is suitable for almost all the population. At the moment, my eldest patient is about 97, but I also have international rugby players. So chiropractic care is suitable for virtually everybody. Chiropractors use a package of care, so there's a misconception that chiropractors only manipulate. Chiropractors actually look after the patient and they give them manipulation, mobilisation. They might use dry needling, they might use ultrasound. They also give them ergonomic and lifestyle advice. So it's actually tailoring the package of care to that patient. When a patient comes to see me for the first time, we go through a medical history. We then go through a physical exam, which will consist of orthopaedic and neurological testing. If necessary, we can take x-rays, or if there's further investigations needed, we might refer out. After that, we do a report of findings, which basically tells the patient what we found and how we're going to try and tackle their problem. This gives them an idea of what to expect from treatment. So dealing with patient expectations is important so we can show them they're going to get better. We think it's very important that patients take a responsibility for some of their care. So one of the things that chiropractors do or might offer their patient is rehabilitation, spinal rehabilitation, where patients are given supervised exercise and sometimes doing exercise by themselves. Lifestyle advice is very important. There's no point in the patient coming to a chiropractor, the chiropractor helping them, and the patient doing something that might aggravate that problem. So looking at how they live their life, from how they drive their car, to what bed they sleep in, to what pillow they use, are also very, very helpful bits of advice. People have a misconception about manipulation. Manipulation is often very gentle and is very, very specific. But chiropractors have a numerous range of techniques they can use, from fairly physical techniques to much lower force techniques. Because chiropractic is governed by statute, chiropractors have to do CPD or continual professional development. This basically keeps them up to date with the best techniques so the patients can be assured of the best treatment at the time for that problem. The best way to find a chiropractor in your local area is if you go to the BCA website, which is chiropractic-uk.co.uk, you can actually search by postcode or search by town. In our experience, it's in the patient's best interest that chiropractors work well with other healthcare professionals so the patient gets the best outcome.
Back pain is a huge problem in the UK. It affects 4 out of 5 adults at some stage in their lives and places a huge burden on NHS patients. The British Chiropractic Association believes that we can deliver high quality, effective and cost-effective care for patients, both within the NHS and outside of the NHS. In particular, a recent study conducted in the North East Essex area of the UK showed that chiropractic was highly effective. It delivered high levels of patient satisfaction, but importantly resulted in a significant reduction in referrals to the orthopaedic outpatient department. Those are real solid figures, and we feel that the incorporation of chiropractic treatment into the NHS would produce huge benefits for patients and NHS providers. Chiropractic is not just about cracking backs. There's a whole range of treatments that chiropractors deliver in terms of delivering a patient-centred approach. We will utilise not only spinal manipulation, but we will use other evidence-based treatment techniques which will involve empowering the patient as well as delivering good results.
I became involved with chiropractic treatment 15 years ago after a road traffic accident. Very interested in forms of treatment and decided to go down the chiropractic route. The chiropractor initially took a full case history on the problem that I was experiencing at that time and then devised really a course of action to actually alleviate that problem. The benefit was that I got my life back and it was just amazing, really.
Patients and healthcare professionals can be assured that when they see a member of the British Chiropractic Association, they can be confident that they're seeing someone who is patient-centred, diligent and well-educated. To be a member of the British Chiropractic Association, we insist on the highest standards of education and also professionalism. This is so that patients can feel confident, doctors and medical practitioners can feel assured that they are seeing someone that they can trust to deliver the best care for their patients.
Your back is very important to you. It's your spine, your vertebral column. The vertebral column are bones that surround the main supply of nerves from the brain down to the rest of your body. The spine keeps you hopefully in a perfect posture. Attached to the spine you've got the ribs, and the ribs protect the heart and the lungs, which are soft organs. The bottom of your spine you've got the pelvic girdle, the pelvic bones, and they support the bowels and the bladder, and they also support the pregnant uterus as the baby grows. Your spine is vital.
Hypnea are the largest independent supplier of memory foam mattresses in the UK today. We have a 20 years combined experience in this field, and we're completely dedicated to alleviating back pain. We deliver best value for money whilst providing a quality product across the entire range. We manufacture all of our own product range from start to finish, so we can control and ensure that every customer gets the correct product arriving to them in the state it's designed to be. We're the first company to offer a 10-year life-last warranty in the UK. Actually, memory foam was developed as part of the space programme, and if you were to take all of our mattresses we supplied over the last 3 years and stood them end to end, that would reach way outside of the Earth's atmosphere. Our aim is to provide not only a fast and efficient service to all of our customers, but to provide the best possible memory foam products every single time. Memory foam does away with the need to be compromising between a soft mattress and a supportive one. It's a technology that was developed originally by NASA to assist in the space programme with the safety of astronauts. It took a long while to get into the commercial development stage, but it's now widely available to all of us. The reason memory foam is so unique is that it is an open cell structure to the foam, meaning the individual cells in the foam have small pockets of air in them. When under pressure, the cells change shape, squeezing air out of the pockets so that the foam moulds to the shape of your body. Memory foam itself adapts by relaxing to your body heat so that it contours and moulds to your shape temporarily while you're laying on the product. When you move, it moves with you, but it softens to your shape, meaning that wherever you lay, you find a comfortable spot. Memory foam mattresses can help people with suffering with pain from all sorts of origins, whether it be arthritis, rheumatism, etc. Primarily because it contours to your shape, unlike any other mattress at all. It will soften and relax and let it accommodate your shape completely, not just part of you, completely absorbing you into the mattress surface. Which means that wherever you lay, however you lay, whether you're a front sleeper, back sleeper, side sleeper, whatever, that you'll find a comfortable position without any problem. You have a much deeper sleep, you get to be supported in that sleep, and also the memory foam keeps you warmer, which helps people with rheumatism, arthritis, etc. With a memory foam mattress, people with back pain should be able to wake up every day feeling refreshed and energised, as if they've just had the best sleep of their lives.
Wow, I can't believe this was the price it was. It was really deep once fully expanded, a little firm compared to my last one, which was really soft, and that seemed to stay flat after a year or so, and that cost £800. So I'm more than happy with this one. I get a wonderful night's sleep, and you can't beat the good memory foam for comfort.
All I can say is this mattress is awesome. Talk about quick, I am now literally sat watching this thing expand in front of me. The pillows looked as flat as pancakes, as did the mattress. Now all is growing fast. Feels comfortable too. Great purchase.
Hypnea offer memory foam mattresses in various different combinations. We have 21 different products available and a whole range of mattress toppers as well. Memory foam mattresses themselves are a complete mattress replacement, so they come as a complete replacement to your existing mattress. It is just a different type of mattress entirely. We have mattresses of different thicknesses and different layer compositions to suit all different needs. There's a very specific need for some customers compared to others as to why they would go one way or the other. We're happy to speak to those people and give them our advice. Many people left to their own devices may well make the wrong choice, so it's worthwhile asking our advice and getting that feedback from us. We have mattresses from just 6 inches thick right up to a total of 12 inches depth, and various combination of memory foam and reflex foam support, whilst some are combined with pocket sprung bases. Further to that, there are many customers out there who may have a good mattress currently and don't feel the need to make the complete change, but would like to get the benefit of memory foam into their lives. It really is that life-changing that they really should. Those people are the ones that should be buying a memory foam mattress topper, and again, those range from a thickness of 1 inch right through to 4 inches deep, and that will transform your current mattress. You won't believe it's the same mattress, but you know it's still there in front of you. It will be the same mattress, just 10 times better. You won't get a better night's sleep. It is important to remember that not all memory foams are equal. They differ a great deal in quality, density, hardness and softness, response to temperature, and also durability and longevity. Many companies offer inexpensive, unbranded, generic mattresses. These are generally made of low-density memory foam or laid with other cheaper foam products and ingredients. These inexpensive memory foams won't provide the same support as a Hypnea memory foam product will do, so it's important to consider this when choosing a memory foam mattress, pillow or topper. We're completely confident that you will find something in our range to suit you. We have mattresses, mattress toppers, pillows, across the diverse range, all adapted to suit different people with different needs, but we have something in the range for everybody. You'll be very pleased to hear that we offer not just fantastic quality, but everything at a tremendously good value price as well, all backed up by our 10-year life-last warranty, so we know that our products will last at least that long, probably an awful lot longer, and that you'll be having a great night's sleep for many years to come. You really will enjoy the experience.
Well, as GPs see an awful lot of back pain, and usually the patient wants something doing pretty quickly. They're in pain, they might be missing time off work. And so initially, we would examine them and make sure there's nothing sort of serious going on. If it's common garden back pain, strain of the lower joints, we might be giving painkillers, we might be given anti-inflammatories, being a tablet form or a cream form. Some patients might even need to have physiotherapy booked as an outpatient at the local hospital. So we're the gatekeepers. We decide what's going to be the best treatment for that patient at that point in time.
As you have seen, suffering from back pain can have a big impact on your everyday routine, making you feel as though you are unable to carry out normal activities such as sport or work. But with the right guidance and support, most people with it can recover without the need for medical help. I'm Georgina Burnett, and you've been watching Back to Health in the NHS.